We presented the trial data for the Rapport clinical trial, which is a dual institutional phase 1, phase 2 clinical trial that was focusing on patients with limited spread of metastatic disease, oligometastatic disease, with 1 to 5 sites from clear cell renal cell carcinoma. In this study, patients were enrolled and received stereotactic radiotherapy to each site of disease, followed by 8 cycles or a short adjuvant course of pembrolizumab, a total of 6 months. The patients had a reasonable burden of disease, with on average having 3 sites. There were 30 patients in total who were enrolled, and the median follow-up was relatively long at 2.3 years. 9 of the patients, or 30%, had a prior metastatectomy. So there were patients who had previous treatments, and about a third of the patients also had prior systemic therapies. They were allowed to have 1 to 2 lines of systemic therapy prior to enrollment. From a safety perspective, this combination was very well tolerated, with only 13% or 4 patients having grade 3 toxicities, and none of the patients having grade 4 or grade 5 toxicities. And 80% of the patients were able to continue and complete all 8 cycles of pembrolizumab. From an efficacy perspective, the objective response rates, those patients achieving a complete response or partial response, was 63%. In comparison, the KEYNOTE-427 study, which was a first-line pembrolizumab study in clear cell renal cell carcinoma, had an objective response rate of 34%. The median progression-free survival in our cohort was 15.6 months, as compared to 7.1 months in the KEYNOTE-427 study. There were almost half of the patients who were disease-free and alive at 2 years, at 45%. And the combination was also very locally effective, with the treated lesions having a local progression-free survival of 92% for all of the 83 lesions that were irradiated. So in summary, this combination seems to demonstrate both safety and seems to demonstrate some quite encouraging activity. And from moving forward from here, it would be interesting to test this combination in a larger cohort of patients in a randomized fashion. This type of approach, while it is quite novel in oligometastatic patients, because even though the approach of metastasis-directed therapy is actually recommended in guidelines for patients with oligometastatic renal cell carcinoma, there is no prospective clinical trial data available until the findings of this particular study. We think the combination of both radiotherapy and a shorter course of systemic immunotherapy may be promising in the future.